A day to help kind of honor those people that we've lost to overdose, kind of support those people that are still dealing with substance use disorders.
Breaking down the walls of substance abuse, that was the goal of a gathering tonight as recovering addicts and families who've lost loved ones to drugs stood up to share their stories on International Overdose Awareness Day.
Sasha Loftus was there. Sasha joining us in studio with more on their message.
Brian and Denise, recovering addicts and those who've lost loved ones hope events like this encourage anyone struggling to come forward. This as we see overdose numbers here in Las Vegas continue to climb.
Recovery is a thesaurus, it's not a dictionary.
Powerful words from those who've seen the worst and started over.
I lived in the flood channels for a little bit. I seen friends of mine overdose down there.
Recovering addicts turned advocates stood up Wednesday to share their journeys while also honoring the lives lost on International Overdose Awareness Day.
And as much as I encourage the participation of the solution, the one thing that I know is I participated in the problem.
This display of shoes represents the 619 people who died of drug overdoses in Clark County last year. Nearly 60% of those were opioid related.
And it's about meeting people where they're at and helping them reduce harm associated with substance use.
Chris Reynolds of Southern Nevada Health Consortium says he hopes gatherings like this help more people come forward and ask for help.
And so once we can break that stigma and be able to talk to people about an issue as if it's an everyday issue, we'll make leaps and bounds forward.
While those who've been through it want their stories to help others move forward and choose sobriety.
This isn't a war on drugs. This is about saving our people. This is about, adding value to this experience.
Now, according to the Southern Nevada Harm Reduction Alliance, drug overdose deaths are up 48% from 2019. They call fentanyl a significant problem as it continues to drive a spike in opioid-related deaths. Brian.
Up 48%.